Welcome to the Lions Bite, where we share information on what lions do as we serve our community. I am a member of the Lions Club of St. Andrew. I am Elvie Pasley, a Melvin Jones Fellow, and a past zone chair. This evening, we will look at childhood cancer. Cancer is a reality faced by thousands of children all over the world. September is Childhood Cancer Awareness Month, and it reminds us that it is an ever-growing epidemic and that with the combined efforts of all of us, there is something, and for that matter, some more that can be done to prevent this disease. With me is Dr. Sharon McLean Salmon, consultant pediatrician, hematologist, oncologist at the Bustamante Hospital for Children. And she will tell us more about childhood cancer. What is childhood cancer?
Okay. Well, childhood cancer is cancer in children. So I'll start there by saying that because there are still a lot of persons who don't recognize that cancer can actually occur in children. So what we have in this situation is that you have abnormal proliferation or growth of cells, and these cells follow signals that cause them to divide, get their own energy from blood supply,
Yes.
and accumulate and invade. So it starts as one cell that has signals to divide against the natural order.
Yes.
And these cells, when they deviate from what is normal, they actually have their own blood supply and have an energy where they actually move from one point to another and divide and multiply and have lots of other cells looking like it, in accumulating and forming lumps and taking over the organ where it lands.
Okay. So what are the types of childhood cancer?
Okay, so with childhood cancer, we do have many types. The most common is acute lymphoblastic leukemia or acute myeloid leukemia, which is cancer of the blood. Then you have Wilms tumor, which is cancer of the kidney. And then there is also a type of cancer called neuroblastoma, which is a cancer of glands within the body. There is also cancers that grow into big lumps, sarcomas. You also have brain tumors where the cancer itself is forming in the brain and causes problems where it sits.
Okay. So Dr. Sharon, what are the signs of cancer?
All right, so the warning signs can be subtle in children. For example, if you have unexplained pain, weight loss, fever, persistent coughing, shortness of breath, night sweats, paleness of the under the eyes, pain in different parts like in the bones and the joints, if there are some lumps or swelling to the neck, if the fever that is unexplained, belly getting big, tummy getting tough, changes in the eye, like, you have a glass eye or, what should be dark in the eye looks actually white, or you can see the vessels behind it. Headaches that get worse, especially in young children, and especially if it's associated with vomiting or nausea, more, just getting worse with time. So those are some of the things that should alert you that something is wrong.
What advice do you have for parents who would have a child diagnosed with cancer?
The first thing I would say is cancer is not a death sentence. So when persons hear about cancer, they think about, all right, my child is going to die. Just like, I guess in adults, that's how persons feel, once a diagnosis of cancer is made. It is a life-threatening illness, but it can be cured, and children actually have better outcomes than adults most times. The key is catching it early. So at the point now where the diagnosis is made, I mean, from my perspective and those who are trying to raise awareness, we want parents to be acutely aware of some of the signals that they should consider cancer in a child and should consider that maybe their child needs to be taken to the doctor and get closer examination. So the whole message would be the earlier we catch it, the more likely the outcome will be what everybody wants, which is cure.
Yes.
So with once a diagnosis is made, I said, don't worry about it. We are going to try everything to make sure that this child can survive this cancer. It is a fight for his or her life.
Yes.
It's not going to necessarily end in death. It's not a death sentence. We'll just try our best and see every level of care that we can offer to get it to go away. That's what we'll do.
And with this sort of facility, who would be part of the child's health care team? What
Well,
would the parents expect?
if they come to, it depends on the level of care that we're talking. So if they're already at the hospital, right? If it's a pediatric hospital, we're all dealing with children there. So they will interact with the pediatrician, who will then interact with myself.
Yes.
There's another specialist in the island. There are just two of us, myself and Dr. Reese Mills at University of the West Indies.
With just two persons with your specialty, where should parents obtain information?
So as I said, this month allows us to specifically highlight to the public, but training is ongoing. So we deal with our own private practitioners, our colleagues who will learn about signs and symptoms and how to refer.
And Dr. Sharon, I am sure that when parents are told that their child has cancer, they have many questions.
Sure.
What tips would you give to parents? Like, who should tell the child? When should the child be told? What do you say to the child? How
Okay,
much should the
those are
child be told? How much information should you feed into this child?
right. So you know that children are from 0 to 18, right? So it's going to depend on the age of the child and how the exchange of information goes. It has to be exchanged if it is chosen to be, and that comes down to a decision on the parents' part. So we do urge the parents to be truthful and honest with their kids, but it has to be at a level that they will understand. So sometimes what we do is we ask the parents, we always say, tell the child,
Yes.
because it helps them to reinforce the trust that they have in their parent, rather than hearing another child who has it tell them things that are probably inaccurate, or they hear it in passing, right? It's not useful to hide it from the child, right? We do offer ourselves, like me, would sit in with the parent on their request if they want, while they tell the child. Some parents actually find that very difficult to do, but we always try to reinforce and encourage them to just speak truthfully and let them know it is an illness. Mommy and daddy are going to fight with you to make sure that you get better. We're working with the doctors. it helps us with the treatment too and their attitude to treatment. Because if they're blinded, not knowing what is happening, sometimes that's when they get the most resistance.
Yes.
And if they find out that, and it's not the parents that told them or the parents lied about
It's
they
worse.
lose trust
It's
in
worse.
whatever the parent says. Or if the parent says it's going to be okay, they'll
Yes.
never believe that because the parent wasn't upfront with them or truthful. So we try
Yes.
to encourage openness and we make ourselves available.
And
to
yes,
sit.
and Dr. Sharon, you have to deal with the situation day in, day out.
Correct.
What sort of reaction do you get from these children? What should be done to help them to cope?
To the children, okay. So, because the reactions initially come from the actual parents.
Or
Um,
so the children?
yes, both have their own levels.
Yes.
So, the children, um, the first thing is fear. They're now being admitted, lots of pokes, sticks to take blood, do investigations. They're uncomfortable with the treatment. It may make them feel sick, just like how it makes them feel sick if you're in the adult world. And coping with all of those, if you put yourself in the shoes of a child, is very difficult. You're at home in the comfort of your home. You started to feel unwell. Now you're in this strange place where mommy and daddy are not there all the time. Grandma not there.
Yes.
And these doctors who I don't know are sticking me, giving me medication, taking blood is very frightening. So we do get mostly tears, fighting,
Yeah.
resistance. Uh,
Yes.
there's some that we are successfully able to engage, and they say, "I know I have to get stuck. I'm not going to cry," and they stick out their hand and say, "I want to be stuck here." We give them, involve them in the care. So sometimes we allow them to wipe the area that's going to be stuck, and then we wipe over to make sure it's done properly. We allow them to choose which hand, they want to be stuck
Okay.
on.
Let them feel comfortable.
They feel like they have a little power or say in what is going on, and I think that helps.
Yes.
And where we can, we treat them like if it's a birthday. We celebrate that. We buy a cake, buy some balloons tied to the bed, sing happy birthday, allow them this one time to take pictures. When we can get them home for even a day or two, we'll let them go home and then look forward to that. And we encourage them to read and buy books for them and so on. These are things that we would do to try and make it not so difficult an experience.
Yes. Well, Dr. McLean Salmon, I
Mm-hmm.
would like to thank you so much for taking the time to share insights in childhood cancer. As we are aware, Childhood Cancer Awareness Month is just not for children, not for the children who are fighting this horrible disease, but for those who have lost that fight and their families. Cancer takes over a family's life when it is an adult patient. When it is a child, everything is overturned. We invite you, all of you, to be champions to this cause. To express this, you could pin a gold ribbon to your shirt, as gold symbolizes how precious children are and the resiliency of childhood cancer heroes, and they are heroes. Wearing a gold ribbon shows your dedication to the cause, and it encourages others to do the same, creating a chain reaction that boosts awareness and inspires social action in your community. You may also support initiatives that are aimed at raising funds for childhood cancer. If you can, adopt a child. You could go even further. Adopt a pediatric ward. Let us be bold and go gold for childhood cancer.